Good evening, friends. Today, July 14, 2026, we are covering the major recent updates in obstetrics and gynecology. Major headlines. Welcome back, colleagues and students. Today, we are breaking down the absolute latest, high-yield updates in obstetrics and gynecology that dropped over the last few weeks. We have historic shifts in vaccine guidance, landmark study data on postpartum care, and major guideline corrections you need to know for clinical practice and board exams. Let's jump straight in. Part 1, Obstetrics and Maternal Medicine #1. The historic 2026 maternal immunization schedule. The update, the American College of Obstetricians and Gynecologists, ACOG, released its independent maternal immunization schedule, explicitly diverging from federal vaccine timelines to counter healthcare confusion and misinformation. Core takeaways. Influenza, administer inactivated/recombinant types at any gestational age. Safe for breastfeeding. COVID-19, routine administration supported at any time during pregnancy. Recent, July 2026 data on UpToDate confirms maternal vaccination significantly reduces infant COVID-19 hospitalizations. TAP, firmly placed between 27 to 36 weeks of gestation for optimal antibody transfer. Maternal RSV, a Briscoe-guarded timing window strictly maintained to optimize infant protection against respiratory syncytial virus. 2. Postpartum hemorrhage, PPH, definition and emotive bundle. The update, the newly fully adopted WHO and FOGSI clinical alignment guidelines, https://www.youtube.com/watch?v=CGU_YY_EZQ, unify the definition of PPH. Core takeaways. Unified definition, PPH is now defined as blood loss greater than or equal to 500 milliliters regardless of delivery mode, vaginal or cesarean section. Early shock trigger, any objective blood loss greater than or equal to 300 milliliters accompanied by clinical signs of shock must be handled as PPH. Shock criteria, SBP less than or equal to 100 millimeters of mercury, DBP less than 60 millimeters of mercury, or shock index 1. The emotive bundle, mandates early calibrated Drake measurement, slow 4-oxytocin, 1G tranexamic acid, within 3 hours, crystalloids, and rapid progression to balloon tamponade or B-Lynch sutures if refractory. Part 2, high-impact maternal clinical trials. Clinical issue, recent findings/study, July 2026, actionable clinical implication. Post-hypertensive care, only 35.3% of HDP patients seek, mandate hard-coded post-discharge HER. Preventive care within 12 months. Prompts to schedule a 1-year follow-up. Acetaminophen exposure landmark JAMA study shows no risk, validates safety of targeted Tylenol. Of autism/ADHD via prenatal usage. Usage for maternal pain management. Fetal kidney failure, in utero womb fluid infusions, a new avenue for fetal therapy in cases. Significantly increase birth survival of severe oligohydramnios/renal failure. #1. Hypertensive disorders of pregnancy, HDP, postpartum gap. Data presented at the ACOG annual meeting revealed a massive gap in preventive health. Despite high cardiovascular risks, a mere 35.3% of women with HDP completed an outpatient health assessment within the first postpartum year. Clinics are urged to utilize structured postpartum navigation teams. #2. Prenatal medication safety clearances. Acetaminophen, a major JAMA study, confirmed no causal link between prenatal acetaminophen use and neurodevelopmental conditions like autism or ADHD, easing widespread patient anxiety. Acid suppressants. Concurrently, large-scale registry data cleared prenatal acid suppressive therapies from any direct link to childhood inflammatory bowel disease, IBD. Part 3, Gynecology and Reproductive Medicine #1. Postmenopausal bleeding, PMB, triage shakes up. Asterisk the update, the freshly modified ACOG Clinical Practice Update, addresses limitations in relying strictly on transvaginal ultrasound, TVUS. Asterisk core takeaways. Asterisk dual evaluation preferred. While an endometrial thickness, ET, less than or equal to 4 mm on TVUS remains a strong negative predictor for endometrial cancer, new guidance notes that specific high-risk demographics require simultaneous tissue sampling or direct visualization at initial evaluation, regardless of ET numbers. ## 2. Cervical cancer prevention and HPV testing. Asterisk the update, highlighting cervical screening awareness, https://www.instagram.com/p/doj0wagml. ACOG reinforced the definitive preference for primary HPV screening over solitary pap smears. Asterisk core takeaways. Asterisk preferred protocol, for women aged 30 to 65, primary HPV testing every 5 years is the gold standard. Asterisk self-collection approval, clinically validated, self-collected HPV sampling kits are officially integrated as an option to increase screening access for average-risk individuals. ## 3. IVF optimization and environmental concerns. Asterisk single embryo transfer, SET extensive data published this month shows SET achieves superior maternal-fetal safety outcomes and comparable live birth rates compared to multi-embryo transfer in modern IVF cycles. Asterisk microchemical alert, a troubling July study revealed that both synthetic and organic tampons leach detectable levels of hormone-disrupting heavy chemicals. This highlights an immediate need for patients to diversify menstrual hygiene alternatives. Part 4, High-Yield Revision for Exam Takers. Rapid Fire Board Pearls. Asterisk first trimester dating, crown rump length, CRL, remains the single most accurate ultrasound parameter for establishing gestational age. Asterisk placenta previa triage, the classic 4-type classification is completely outdated. Modern classification relies simply on 2 categories, low-lying placenta, within 2 cm of the internal OS, or placenta previa, covering the internal OS. Asterisk tocolysis guardrails, FOGSI guidelines emphasize that if you are administering isoxaprine, you must hold the medication if maternal pulse matches or exceeds 140 bpm, or if blood pressure drops below 100/60 mmHg. Asterisk magnesium sulfate reminder, magnesium sulfate is strictly for fetal neuroprotection and seizure prophylaxis, it is not a primary tocolytic. Never co-administer it concurrently with nifedipine due to severe neuromuscular blockade risks. General medical snippets. What is vestibular migraine? A vestibular migraine is a nervous system problem that causes repeated dizziness, or vertigo, in people with a history of migraine symptoms. Unlike traditional migraines, you may not always have a headache along with dizziness, you may have symptoms such as loss of balance and nausea, with or without head pain. WebMD. RS-Pre-F. Maternal respiratory syncytial virus, RSV, prefusion F, RS-Pre-F, vaccination during pregnancy is associated with more than 65% protection against RSV-associated acute respiratory illness, ARI, hospitalization in infants 90 days or younger. Medscape. Soda and fruit juice. Consuming soda and fruit juice has been associated with more advanced liver fibrosis. In one striking randomized controlled trial, consuming 200 g of fructose daily for just 2 weeks was enough to raise liver enzyme levels in healthy adults. For perspective, a 16-ounce soda may have nearly 30 g of fructose. Importantly, naturally fructose-containing whole fruits such as mangoes, grapes, and apples have not been associated with hepatic steatosis or MASLD development, likely because of their fiber and overall nutritional composition. Therefore, consumption of whole fruits remains recommended despite its naturally occurring fructose content. Medscape. Outro and CTA. That wraps up our 20-minute update for this month. Drop a comment below on which clinical change affects your practice the most, smash the like button, and subscribe to stay ahead of the curve. See you next month. Disclaimer: compiled information. This content is for educational purposes and is not a substitute for professional medical advice. The audience must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm.